this is Joseph Infante with Sexual Men's Health. Before we dive into how stem cell therapy for erectile dysfunction works, let me spend a few minutes explaining what causes ED. Erectile dysfunction, sometimes called impotence, is a repeated inability to get or keep an erection firm enough for sexual intercourse. The word impotence may also be used to prescribe other problems that interfere with sexual intercourse and reproduction, such as lack of sexual desire and problems with ejaculation or orgasm. Using the term erectile dysfunction makes it clear that those other problems are not involved. Damage to nerves, arteries, smooth muscles, and fibrous tissues, often as a result of a disease, is the most common cause of ED. Diseases such as diabetes, kidney disease, obesity, heart disease, neurological disease, chronic alcoholism, multiple sclerosis, and vascular disease account for about 70% of erectile dysfunction cases. Between 35% and 50% of men with diabetes experience erectile dysfunction. Let's talk the mechanics of an erection. Erection of the penis is a hemodynamic action of two tissues, the corpora cavernosa and the corpus spongiosum. This tissue consists of smooth muscle, endothelial cells, fibroblasts that interact in order to enhance and maintain an accessory blood supply causing erection. Given the need for the blood flow during this response, it is clear that vascular insufficiency can decrease erectile capability. In fact, vascular insufficiency may be a common pathology of erectile dysfunction. It is estimated that up to 80% of the cases of erectile dysfunction can be attributed at least in part to a reduced blood flow, typically due to an underlying vascular disease. Pharmacological methods have been used to treat erectile dysfunction, including the use of vasodilators such as Viagra and Cialis. However, vasodilators induce only a temporary response and are not effective in many patients due to the underlying endothelial damage. Not to mention the fact that these medicines can have serious side effects, including heart attacks, strokes, and may even cause death. Stem cell therapy is revolutionary because it addresses the tissue defects and/or vascular disease underlying the problem, thus providing a longer-term therapy or even a permanent solution. I know what you're thinking. What are stem cells? A stem cell is essentially a blank cell capable of becoming another more differentiated cell type in the body, such as a skin cell, a muscle cell, or a nerve cell. Microscopic in size, stem cells are being used in medical and science circles because they can be used to replace or even heal damaged tissues and cells. They can serve as a built-in repair system for the human body, replenishing other cells as long as a person is still alive. There are two major types of stem cells, embryonic stem cells and adult stem cells. Currently, there are no successful therapies in humans using embryonic stem cells. However, adult cells have already been successfully used for multiple conditions, including diabetes, retinal disease, arthritis, renal disease, multiple sclerosis, erectile dysfunction, among others. And new therapies using adult-type stem cells are being developed all the time. So what are adult stem cells? They naturally exist in our bodies and provide a natural repair mechanism for many tissues of our bodies. They belong in the microenvironment of an adult body, while embryonic stem cells belong in the microenvironment of the early embryo, not in an adult body, where they tend to cause tumors and immune system reactions. Adipose, or fat cell tissue, is an excellent source for adult stem cells to treat erectile dysfunction and other conditions. So what does the procedure involve? The procedure is performed by board-certified physicians, scientists, and clinicians in 4 to 5 hours. You will be treated with local anesthesia, therefore the procedure is practically painless and fits easily into an active lifestyle. Using a simple procedure similar to liposuction, 100 to 200 cc of adipose tissue is harvested from the patient. The adipose tissue is then broken down to extract the stem cells. We then separate the adult stem cells from the fat cells. The isolated adult stem cells are then suspended in the person's own platinum-rich plasma therapy growth factors and activated with laser. This awakens or activates the dormant adult stem cells. The cells are then administered back into the patient through one or more of the following modes of administration: through a standard intravenous drip or directly into a localized area. Stem cells are dispersed into the adjacent tissue. They differentiate into component cell types and integrate with the target tissue or organ. They begin to secrete several essential growth factors and start to attract the growth of blood vessels to facilitate tissue transformation and repair. Here's the best part: there is no risk of immune rejection, as the patient receives their own cells. Moreover, some patients start feeling the benefits right away. Now you're better informed on the benefits of stem cell therapy and how it can treat erectile dysfunction in order to restore your confidence in yourself and in the bedroom. Take a few minutes to fill out the application below and see if you qualify to be a candidate for this revolutionary procedure. If you have any questions, feel free to contact us